Evening, everyone. We are so happy that you are here today. My name is Robin Anderson, and I am from the Executive Director for the Ministerial Health Fellowship. And we are so glad that you joined us on tonight this is a coalition that has been established between Health Equity Solutions, Ministerial Health Fellowship, the Fighting Back organization, as well as Connecticut Students for a Dream. And this is one of a series of workshops that we will actually be offering, and we hope that you would be able to join us for each and every one of the workshops that will be presented. Tonight, we will be looking at Husky 101 and just talking about Husky and making sure that all of us are on the same page and understanding Husky and how important it is that we also advocate to make sure that undocumented as well as parents have insurance for themselves and also for their children. So we're going to learn tonight about Husky 101. And then on September 23rd, we will be looking at navigating the healthcare system. What an opportunity that will be for us to see. I'm still learning how to navigate the healthcare system. So we will be also presenting that workshop. And then really all of us should be advocates. All of us should be advocating for healthcare policies, especially that will address health disparities, as well as the healthcare for African American and Latinx and just people people of color. And then that will be held on October 6th. And then also another workshop will be letter writing and storytelling. That is so key and so important. Even myself, in terms of, I love that particular workshop because I learned more things about the importance of writing to your legislators, about being able to tell the story about what you're encountering and some of the things that people are dealing with in the healthcare system, to be that voice for others. And then the one that will be last but not least will be on November 4th. And we will kind of do a mock public hearing training, just so you can kind of experience what it's like to be able to testify, be a part of a hearing also, and just kind of see the ins and outs of that. So when it's time for the legislative session to take place, we will be equipped, we will be ready, and we will continue to take advocacy to another level. At this time, I'd like to introduce to you the one who has really led this project and has led it well. And so we thank her for her leadership. And that is Dawn Fuller Ball, who works for Health Equity Solution as the engagement specialist for this project.
Thank you, Reverend Anderson, for that wonderful introduction. We are working on getting Spanish translation services available. You'll see that get started soon in the background, and we appreciate your patience while we get that together. There will be opportunities for questions and discussions throughout the presentation. Once the presentation is finished, you can also raise your virtual hand or use the Q&A feature, or put your questions in the chat. During the presentation, everyone will be muted. My name is Dawn, again with Health Equity Solutions, and I'm the Community Engagement Specialist. And Health Equity for the People, by the People is a coalition, as Reverend Anderson spoke of several different organizations. That includes Ministerial Health Fellowship, Health Equity Solutions, Connecticut Students for a Dream, and Make the Road Connecticut. And we are happy to have you all here with us. So we want your feedback, and we ask that you stay until the end of the workshop and complete the short evaluation. We would really appreciate that. Karen, would you like to introduce yourself?
Everyone, my name is Karen Siegel. I am the Director of Policy at Health Equity Solutions, and I'm happy to be with you here today. And this is a quick look at our agenda. So first, we're going to talk about what Husky Health programs are, who they cover, will be the next section, Then we'll go into what benefits Husky covers. And then finally, we'll talk about a new program called Covered CT that includes some Husky services. So what is Husky Health? In a nutshell, it's Connecticut's Medicaid and Children's Health Insurance Program, or CHIP. These are both public health insurance programs for lower income people. And they are both funded jointly by the state and federal governments. And states have a lot of control over how they run their Medicaid programs. So there's federal oversight and guidelines, but Medicaid differs a lot from state to state, both in who it covers and in what benefits it offers. Both of the Medicaid program is the largest source of federal funding in Connecticut and in most states. But what does that really mean for people who are enrolled? Well, Husky is essentially free, comprehensive health insurance coverage for about 1 million people, or nearly a third of Connecticut's residents. CHIP is a relatively small portion of that. It's about 20,000 children, but it's also included in the Husky programs. Enrollment has grown a lot during the pandemic, both because of people losing their jobs and associated health insurance, and because of a federal rule saying that states can't disenroll anyone during the public health emergency. So there's a lot of research showing that Medicaid enrollment has really positive effects. Things like reducing medical debt, improving health overall, increasing access to physical, mental, and oral health services. And because of the impacts of systemic racism that mean Black, Indigenous, Latinx, and other people of color are more likely to live in low-income families, Husky programs have a disproportionate impact on people of color, and as a result of that, offer a lot of opportunities to address health equity. These programs also have powerful benefits and a really high and fast return on investment. And this is especially true for children. Research has shown that Medicaid enrollment increases the likelihood of doing well in school, going to college, and then paying enough in taxes in your early adulthood to more than cover the costs of being enrolled. And I don't think that's surprising to any of us. We all know as advocates that giving people the opportunity to be healthy has a huge impact on their ability to learn, be economically stable, and avoid all of the stress that's caused by not knowing what you would do if you had an accident or a chronic illness that needs treatment. And I just wanted to note at the end of this section that Husky does not include Medicare. So Medicare is another public health insurance program. It is entirely federally funded and run. So Medicare is all run at the national level. It has multiple parts. It does not have income limits, but it does have some costs associated with it and a lot of kind of special sub-programs. And Medicare is specifically designed to cover older adults and people with disabilities. And you'll see when we get into who Husky covers that Husky C also covers people who are older adults or living with a disability. And so people enrolled in Husky C are almost all enrolled in both Medicaid and Medicare. So that is our first section on what Husky Health programs are. Are there any questions?
I have 2 questions. The first is, what is Medicaid unwinding?
So Medicaid unwinding is how people have been talking about what will happen at the end of the public health emergency. So I mentioned that there is a federal rule that was passed during the pandemic that says states can only disenroll people under very special circumstances. So for example, if you call and say you don't want to be enrolled anymore, or you move out of the state and you report that to the state, then they can take you off of enrollment. But otherwise, for the duration of the public health emergency, people cannot be disenrolled. And there's a lot of concern about, this, what people are calling unwinding, because there's a lot of paperwork and because of housing instability that's happened during the pandemic, people might not see paper notices or they might not understand them. And so there's concern that when the emergency ends, people might lose their coverage even if they're still eligible. And so that's what that's about.
Thank you. The second question is, when a person applies for CHIP or Husky, do they qualify for one or both programs, or are they enrolled in both?
So CHIP is one of the programs of Husky, and we're going to talk about that more in a minute. And you would only be enrolled in one or the other. So CHIP is only for children. And if you're a child, you would either be put into Husky A, which is Medicaid for children, or Husky B, which is CHIP for children, based on your family's income. So you would just have one or the other.
Thank you. That's all the questions for now.
Okay, great. We're going to move on to the next section. So before we start talking about who's enrolled in Husky, I wanted to talk a little bit about the federal poverty level. So this is something you'll see and hear on the next few slides. So this is what is used to figure out or to determine eligibility, to figure out who is eligible. So most Husky enrollees are eligible based on their income only, their household's income. And the US Department of Health and Human Services uses a standard called the federal poverty level to figure out who is eligible for each program. This level increases each year and for every person in your family or household. So what does it look like? So in 2021, if you're earning 100% of the federal poverty level, which basically just means you're earning what they consider to be that poverty level, that means that you're one person earning less than minimum wage working 20 hours per week. So it's quite a low bar, particularly in a state like Connecticut, where the cost of living and housing are so high. And for a family of 3 in 2021, that federal poverty level would still be under minimum wage, working 40 hours per week. And you can see that then it gets a little higher under when you go to 200% of the federal poverty level, but it's still under minimum wage, working 40 hours a week for one adult. And it comes out to about $21 an hour if you're working 40 hours per week. But most households size 3 would have at least one full-time working adult. So that is kind of how these numbers are determined, and you'll see more of those on the next page. We also included at the very end of the slide deck a chart that shows you at each of the eligibility levels what that translates to in annual income. So who's eligible for each of these programs? Husky A covers children, pregnant people, and parents and caregivers. And it's important to note here both that the eligibility limits are different for each of those groups, and that Husky programs consider a fetus to be a household member. So a pregnant person always counts as 2 people, and sometimes more if it's a multiple birth. Husky B, as I mentioned, is Connecticut's CHIP program, Children's Health Insurance Program, and it covers children and families that have an income over the Medicaid limit and under the limits listed here. It does have some costs for children in the highest income levels, so it has 2 tiers, and those are listed here. So families in this higher tier would pay some premiums and copays, and I talk more about that in the next section about what those are. Husky C is Medicaid for seniors and adults who have disabilities and who meet asset tests. So Husky C covers people with very low incomes and requires an asset test. And the income limits are monthly and vary by region. So it's a little bit different than the others, which is why I didn't list it here. But just for example, the highest income you could have in Connecticut would be a married couple earning $783 a month who have no more than $2,400 in assets. There are some exceptions to what counts as an asset, including the house that you live in and possibly a car. And there are other programs to help people with disabilities who are employed pay for their health coverage, but all of them have limitations. And you can see here that the income limits for Husky C in particular are very low, and the asset limits also are very low. And Husky D covers adults who do not have dependent children. So it doesn't mean that you can't have children to be enrolled in Husky D. What it means is that if you do have kids, they're either over age 18 or you don't have custody of them. Or you could just be an adult without children or dependents. So how does immigration status impact eligibility? So this is another factor. To enroll in Husky, you must be, the legal terms are both lawfully present and a qualified non-citizen. And this includes groups like green card holders, asylees, refugees, and other limited categories of folks, visa holders in the US. It does not include DACA recipients or enrollees. And if you have been in the United States as an immigrant for less than 5 years, you can only enroll if you're pregnant, or for Husky A, you're under age 21, and for Husky B, you would need to either be pregnant or under age 18. People who do not have documents can only be covered for a limited set of services that are deemed life-saving care. And that includes labor and delivery in Connecticut. And also under the public health emergency, it includes COVID-19 testing and vaccination and other things. Anyone who has followed the recent work of CIRA or Connecticut Students for a Dream knows how arbitrary what's considered life-saving can be. So it really is not comprehensive, but there are some Medicaid funded benefits. And of course, anyone can go to an emergency room without insurance in a life-threatening situation. And that is also about to change a little bit. So there are some new programs. And starting in April of 2022, there will be prenatal care through a Husky-like program, a program under the Husky umbrella for undocumented people. And it will also begin to cover undocumented children up to age 8 in January of 2023. And then postpartum coverage for undocumented people for 12 months after giving birth. So there are some new programs that will open up to provide coverage for folks who do not have documents. And then Husky also, the Husky umbrella or the Department of Social Services in Connecticut, the medical programs include a whole bunch of other programs. Some of these are limited benefit programs. Some of them are for very specific populations. Some are block grants. Some count as Medicaid, some don't. But there are a lot of smaller programs or more limited programs under that kind of Husky umbrella. And the largest of those includes the Medicare Savings Program, which helps people who are not in Husky C pay for their Medicare premiums. So it's another program that has income limits and is just a premium assist. Others are very specific. So for example, just talk about one of these, the Katie Beckett waiver has a limited number of spots to offer Medicaid coverage for children who have complex health needs, living in families that earn too much to qualify for Medicaid. So for example, a kid who has a condition that requires a feeding tube and maybe a motorized wheelchair and regular expensive medical coverage would be able to apply to have a spot on the waiting list to get one of the slots in this program. All right, so that is the summary of who is enrolled in Husky, and now I'm happy to take any questions.
So there's a question about visas. If you could explain more about that, please. Who is eligible with a visa and who is not eligible with a visa?
So it's a little bit complicated, but the basic answer is anyone who has a long-term, an LPR, a green card, and has been in the country for 5 years would be eligible. Anybody who has that visa and has been here less than 5 years, but is either under the age of 18 or is pregnant. And then there are a whole bunch of special protected immigration categories, including some asylees and refugees who would be eligible.
Thank you, Karen. There is another question regarding, has the eligibility or the guidelines changed regarding the pandemic?
So no, the eligibility limits have not changed during the pandemic. What has changed is that the Medicaid program, the Husky Health programs, cannot disenroll anyone. So unless you choose to leave the program or you notify them that you have moved out of state, they are not removing members. So that's part of why it's grown. A lot of people lose their Medicaid coverage because they don't provide their proof of income, for example, when asked for it, either because they don't see the notice or it's confusing or the system makes it very difficult to deliver that information. And that is not happening currently because there's a federal law was passed that requires no disenrollment during the public health emergency, except in very limited cases.
There is a question whether or not this information is public about eligibility. Yes, it is public. And is there, what about Medicaid unwinding?
So Medicaid unwinding is how people have been talking about what happens when the public health emergency ends. And there has been recently released federal guidance that that requires the Medicaid program to check everyone's eligibility again once the public health emergency ends before removing anyone. And that's good news because it means they can't use old information. They have to come back to you and ask for verification before they can say you're no longer eligible. Beyond that, you know, there's a lot of detail around how that will happen. The state of Connecticut has given extended timelines for verifying income and assets for people during the emergency, and that will continue. And I'll also give some resources at the end of the presentation for where you can go for more detailed questions if you have a specific case or a specific problem and you need a more legal answer.
Thank you. Thank you, Karen. We do have to move on to the next section. However, we can ask these questions at the end. We'll answer these questions at the end.
Thank you, Harley. Okay, so now we're going to talk very quickly just about what Husky covers. And we wanted to do a quick poll. I'm hoping we can launch it. Just asking you to take a guess about which of these things the federal government considers mandatory and which it considers optional. So are we able to launch the poll?
Don, can you please launch the poll if you're able? Thank you.
Prescription drugs.
The poll has been launched. Can everyone see it?
Yeah, it looks like people are filling it out. All right, in the interest of time, I'm gonna say we should just move on. But we have like a wide variety of answers, and I think that's very reasonable because I'm gonna just show the answers now because as you can see, this is really kind of arbitrary, right? It doesn't make a whole lot of sense which of these things are mandatory and which are considered optional. They're all important to our health. So the good news is that all of these things are covered by the state of Connecticut. This provision called early and periodic screening, diagnostic, and treatment means that anybody under the age of 21 who's enrolled in Husky has to receive any service that's considered medically necessary. And that's really kind of across the board. And the other thing is that the state of Connecticut also covers dental coverage for both children and adults, and that is not the case in a lot of states. So dental care for adults especially is a pretty rare benefit and a really important one. The bottom line is it's a pretty comprehensive package of benefits that cover physical, mental, and oral health, including specialty care. And then Husky B is a little bit different. And Connecticut's one of a few states that keep their CHIP programs separate. And so there are some differences in what benefits are covered. But particularly in the last year or so, the state has made the programs very similar. So it's likely to really seem the same to enrollees. The differences would be around specialty care and conditions like autism that require particular sets of services. And there could be additional requirements around getting prior authorization for some of those services. And the other thing that's a little bit different about Husky B is that, again, it's broken up into those two tiers, and the families earning over 201% of the federal poverty level would be paying up to $50 a month in premiums. So it's $25 for one child and $50 for two or more children, no matter how many there are. And this is certainly a lot of money to a family, but it's much less expensive than a lot of other insurance programs for a pretty comprehensive benefit package. And we wanted to just take a moment to talk about this a little bit. So like on paper, this looks great. It shows that Husky provides mostly free coverage for a whole wide range of health services. But if anyone has been enrolled in Husky programs like I have and like my family has, I think we all realize that it's far from perfect. And I'll share that for me, the process of enrolling was confusing, really confusing for me and for my family. And before we moved on to our last few slides, I wanted to just open it up and see if anyone else had something they wanted to share about their experience with the benefits. Or difficulties accessing them.
We have
Sorry.
Deason Garcia, who has her hand up.
Hi, I had a question before. It was because I heard you said that there are Husky for pregnant moms and they will be able to be covered for a year after giving birth. So because I work for the Hispanic Health Council and I'm seeing that many moms had their Husky canceled after giving birth, and sometimes they need help to get a breast pump, and then they don't have access to get it from the Husky because they had canceled it once they gave birth. So I'm not sure if, because you said that they're covered for a year after, I'm not sure if they have to apply again or what they can do. Sure, many moms are getting their breast pump during their pregnancy, but not everybody.
Yeah, and that's somewhat new. So it used to be that coverage in Medicaid was only for 90 days after birth. Now it's 1 year, and it should be automatic unless the person falls into an income gap, right? Because well, even then, it should be automatic that it's extended to a year. It's possible that at the end of that year, the person would lose coverage if they're eligible as a pregnant person, but not eligible as a parent. And because the income levels are different, it's possible to lose coverage. But it should be automatic from July 1st that it's coverage for a year.
Got it. Okay. Yeah, because the most people what I work with is with undocumented moms. So that's why I was asking.
Okay,
Thank
and that
you.
hasn't started yet. So postpartum coverage for undocumented moms doesn't start until 2023, unfortunately. So that would have been definitely a problem in the past and still now until that program launches.
Got it. Thank you.
We have Yuri Diaz, who has her hand up.
Yuri, did you want to ask a question?
Okay, next we have Bianca, who has her hand up.
Hi, good afternoon, everybody. I want to share that I am very surprised to know that the hotel section of the Medicaid is optional, and the state can accept or not accept to have this service to the persons. Husky in Connecticut only cover 1,000, so it's very complicated if you have something that, or you need to follow up something in your oral health. It's going to cost you more than 1,000. You have to wait until the next year to continue with the process. So I am very surprised to hear that other states don't have the oral service in their Medicaid. So that's why I think we need to have everybody the same in the whole 50 states, because I can't believe all this irregularity in the service between states. That's my opinion.
And yeah, I think that's a great point. And I also think it's important to note that just because Connecticut's program in this way is better than other states doesn't mean it's good enough, right? The cap and the cost is a problem if you need expensive oral health care. The program would say that you can fight with them to get them to approve costs over $1,000, but you have to find a dentist who's willing to do that, who's willing to do the work to get you approved for more than $1,000 in costs.
Good to know that. Thank you.
Okay, we can ask Yuri again. Are you ready to ask your question? Okay, let's see. There was a question in chat that asked about a model for families needing complex care. I'm not really sure what that referred to.
Yeah, I'm not sure I know how to answer. So there are programs in Connecticut's Husky Health package that address complex care. I'm sure that many of you who have experience with them can speak to the problems with them, but I would have to know more, I think, to understand the question. There are care coordination programs. There's a new program being launched around supportive housing services. It just got federal approval that was announced today. And there's also a program being launched in the next, probably in about 1.5 or 2 years, for families who need in-home services for children with complex needs, to provide whole family services. And that program is still being designed. So there's a lot out there. It just depends on what your needs are, and I would just need more information. Yeah, I'm sorry, I don't know. So we only have a couple more slides, and then I was going to just more broadly open it up for people's thoughts and additional questions. Why don't I go back to the slides and get through them, and then just anything we haven't gotten to, I'm happy to talk about. So the last section is, I just wanted to wrap up by talking about this brand new program. So this was also created in June by a new law. And this program launched July 1st. It's called Covered CT. And it's a hybrid program. So it offers free coverage on Access Health CT, which is the state's health insurance exchange. Some people call the state exchanges Obamacare. And what it is enrollment in a silver plan that has no premium and no out-of-pocket costs. And anyone who's enrolled in Covered CT is also enrolled in Husky Dental and Husky non-emergency medical transportation. So one benefit we didn't talk about is that Husky enrollees are entitled to transportation to and from medical appointments. And the Husky Dental program will be extended to anyone in this program. Starting July 1st, parents could enroll in this program, And starting next July 1st, it will include adults without dependents. So that same category of adults from Husky A and Husky D will be included, but to qualify for this program, you have to have income that's too high for Medicaid enrollment, but less than 175% of the federal poverty level. So still relatively low income. So that's what that is. I think it's a little bit confusing to people to understand that they have these benefits, but I'm hoping that it will mean more people have health insurance and that they can use it because there's no deductibles and no out-of-pocket costs. And then finally, just to wrap up, I wanted to share that these resources. So to find the application for Husky A, B, or D, you go to the State Health Insurance Exchange website, so accesshealthct.org. That's where those applications are. To apply for Husky C or get more information about Husky benefits, you can go to huskyhealthct.org. And then for people who need help with specific insurance issues, whether it's Husky or private insurance, the state has an agency called the Healthcare Advocate, and they're an independent agency, and their job is to help people with health and insurance issues. So if you're being denied care that you think is that you're entitled to, or if you're having trouble enrolling and believe that you're eligible, they can help. And this is their email address and phone number. And all of the organizations that co-hosted the event today are always open to hearing from you. I will put my email address in the chat. I'm also happy to answer questions or talk with anyone who wants to advocate for Medicaid and for making Medicaid better and for the Husky programs in general. I'll share my email address with you. This is the contact information for all of the groups. And I'll come back to this slide in a second, just so that it stays up long enough for you to see. But and then we also had included just at the very end, this is a chart of what does annual income look like at each of the federal poverty levels that we mentioned for each of the Husky programs. And so I'll go back to the contact slide for a minute, and then please, if there are additional questions, or if anyone just wants to say something about this, please feel free to raise your hand or use the chat or unmute. I see a comment in the chat that $1,000 a year is not enough for an elderly person who needs top and bottom dentures with prior extractions. We have to do better. So Brenda, I agree, it's not enough.
Okay, I think we have time for one more question. It looks like Diamond Knight raised her hand. Diamond?
Oh, okay. Good evening, everyone. My name is Elizabeth Knight. I probably hit the wrong button when I was registering for the session. The reason why I don't understand. Now, my son, he has special needs, and the DDS worker told me that in order for him to continue on keeping his services, that I had to, I know this is way off the subject, but I had to let him go out in COVID and in order for him to keep his service. So now he has went out and completed the program, and now they're telling me I can't get a computer for him to do his assessments over online. So this is what I don't understand. If he has Medicaid, and I've went through this before of the discrimination about the services that he's entitled to, if I had been more proactive and been active in what when he was small and I knew now what I knew then, I would have been more of an advocate for his services. And now he's 26 and everything is just, it's all about they dropped the ball. So I would like to go and give my testimony to the legislative services. And if you have the information, you can send me the information. I will go and I'll be willing to testify or whatever I have to do. Thank you.
Thank you, Diamond. That's it's just hard. These services are not easy to navigate. They don't make it simple. And I do know there will be an opportunity soon to comment on the state's long-term services and supports plan, which sounds like it might be relevant to your son. And when we get information about that, we will share it.
Karen, I have one more question in the chat. It says, if you have been on Husky A for years and you're now being transferred to Husky B, do you need to complete a form or will you automatically be enrolled?
So they should send you something that says you're being transferred. It doesn't always happen as smoothly as it's supposed to. So it's a good idea to go online and check and make sure that it happened. But they should send you what they call an automatic renewal notice.
Thank you.
So before I pass it back to Reverend Anderson, I do want to just apologize again for the technical issues. I'm trying to speak slowly enough to allow interpretation to keep up, which is not my usual mode. So I hope this was clear and helpful, and that despite some of the technical issues, we were able to share some information.
Thank you, Karen. I'm going to take it for Reverend Anderson, who had to drop off.